Hello. Hi, I'm Libby Chapman.
And I'm Sara Carvajal. We both work as teacher assistants in public schools in Greenville County.
Yes, our topic for today is the traumatic brain injury, and this has been very interesting and enlightening study in this. We'll start out with the definition of the traumatic brain injury. It is when it occurs when an external force causes brain dysfunction, or it can result from a violent blow or to the head or to the body. It's classified in 3 categories: mild, moderate, and severe. Mild you can usually get over within 3 to 4 weeks, kind of like a concussion, or just when you see small swelling on the head just from hitting something. Or a moderate would be treatment from 6 to 12 months. And then it goes to severe, which it could be life-changing. You could be one way one day, and then after the injury be something totally different. The thing about brain injuries is they are all unique, and they are treated in different ways, all different ways, and the recovery is always different. It is not like any other injury because it can affect your personality. Brain injuries do not always show up at the very beginning when you have the injury, but sometimes it can take days or even weeks to show up. And this is very important when you're a teacher and you have something happen that you know that it might not show up for a few days, and it might take a few weeks to show up. Did you know that traumatic brain injury was not added to the IDEA until 1990? It was not considered a disability until 1990. The definition of the IDEA for the traumatic brain injury is something that applies to an open or closed head injury resulting in impairments in one or more of the areas, such as cognitive, language, memory, attention, reasoning, abstract thinking, judgment, problem solving, sensory, perceptual, motor abilities, and speech. All forms of a brain injury have a range of impact on the ability to succeed in education, in the community, in their vocation, or in their life roles. Each part of the brain controls different functions. So a lot of the head injuries are to the frontal lobe of the brain, and this controls the memory or problem solving and reasoning. And then the back of the brain is where the vision is controlled. We had different characteristics of a traumatic brain injury. One of them is memory and concentration problems, headaches, dizziness, loss of balance, nausea or vomiting, sensory problems such as blurred vision, a bad taste in the mouth, ringing in the ears, sensitivity to light or sound, mood swings, fatigue or drowsiness. And the common causes of the traumatic brain injury are falls, vehicle-related collisions, violence, which makes up 10%, and this includes the shaken baby syndrome, sports injuries, and explosive blast and other combat injuries. Now, Sarah's going to tell us about diagnosis and treatment.
Okay, as Libby said, there are 3 different types of traumatic brain injuries, and they are from mild to severe, and they are diagnosed through different tests like CT scans, MRIs, EEGs, or PET scans. This is made at the hospital. Also, if the patient was in coma for no more than 30 minutes is considered a mild traumatic, traumatic brain injury. Moderate if the coma is no more than 24 hours. And severe is when the coma can be for days or even weeks or longer. The treatment is mainly for moderate to severe, and they just need to make sure that the patient has an adequate oxygen and blood supply. Also, they need to make sure they maintain the blood pressure and prevent the patient from further injuries on the head or the neck. Also, some medications that are used are diuretic, anti-seizure, and coma-inducing. With severe traumatic brain injuries, management of pressure due to the brain that is swollen have saved thousands of lives. This, especially on severe, the patients are kept in coma so that the swelling goes down, and also they try nerve stimulation. Many patients are admitted to the hospital for stabilization, and sometimes they go directly to inpatient rehabilitation centers, or some others are staying on long-term acute care hospitals. The recovery from traumatic brain injury is highly costly because it involves so many professionals. About teaching practices with patients or students with traumatic brain injury, they need their own evaluations, monitoring, and of course their own IPs, individualized education programs. Students with severe traumatic brain injury normally they have obviously physical consequences or speech, so they are easily identified and they enter in the program. But students with moderate traumatic brain injuries, they don't present this so obviously consequences. So that's what this is called epidemic silent. And these students look just like the other students, so they are not easily classified. A lot of these students don't receive services. The majority of these students, moderate traumatic brain injury students, they learn at an abnormally slow normal rate than the others. This made them to be behind, and then some of them are classified under another disability and they get a diploma. But some others, a lot of the others get so frustrated that they just drop out from school. These patients, one of the characteristics is impulsive. So when they are taking a test, they read it and answer very fast, too quick, because they cannot wait, and this prevents them from showing their real knowledge. School and families can help when they have a routine established for classwork or homework. Also, they need to get well educated about the situation for the student, and of course follow their IPs. They don't react very well to new situations, so it's good to prepare them in advance. According to McNamara and Schutz, most students can succeed in regular classrooms after completing a training about how to cope with symptoms. Okay, we have some questions.
Yeah, we had a few discussion questions that we came up with. One of them was, what kind of accommodations do you make for a student coming back to school after a traumatic brain injury? And we came up with a few suggestions. Shorter school day, and try to start them out with a shorter school day and then work up to the full hours of school. Rehearse social situations. This is one of their weaknesses, is going back in with their peers and just kind of role playing those situations that they might encounter before they come back to school. Break multi-step instruction into smaller, simplified steps, because their short-term memory is what's most effective after the brain injury. Pair auditory instruction with visual aids. A special resource period, maybe at the end of the day, for them to do some of their work in there from their academic classes. A peer to help with moving from class to class, because sometimes their balance is off or they're moving slower than before the injury. An extra set of books at home, that way they do not have to carry from school to home, and allowing extra time on test taking. Okay, another question was, can my child get into a special ed program even if he has been diagnosed 6 months after the injury?
And we say yes, because as we know now, if a student is having difficulties in the classroom, and the parent or the teacher can refer them to an A team to be evaluated, so it could be in the program.
Okay. And then what happens if you have a brain injury at school? And you probably will encounter this sometime. It would probably be a mild brain injury if something happens on the playground with the child. We've had children run into poles on the playground, have gotten hurt playing football or kickball. You are obligated as a teacher to take that child to the nurse, and the nurse is obligated to call the parent to let them know of the incident. And it's gotten a lot stricter within the last couple of years, where the nurse even has to have a form signed saying that she contacted the parent by phone to document, because as you know that these do not show up for days and sometimes weeks that you do have a brain injury. So it you really want it documented from the school's point of view. So that was some of the discussion questions we had for our research. But we hope you've learned something about the traumatic brain injury today.
Thank you.